Olá, pessoal. Estamos aqui no ASH, o maior congresso de hematologia do mundo, com essa pessoa queridíssima, especialista em talassemia no mundo, que é a nossa amiga doutora Cappellini, que veio aqui administrar uma aula sobre os riscos de trombose na talassemia. E, doutora Cappellini, eu gostaria que a senhora falasse, para o nosso público de pessoas com talassemia no Brasil, qual a importância dessa aula, e os riscos que nós, pacientes com talassemia, podemos ter de desenvolver a trombose.
Okay, thank you very much, Eduardo, for this question. And this is the topic I'm going to present here at the American Society of Hematology meeting. I focus during the last few years on thrombosis in thalassemia because we found that it is one of the important morbidities in adult thalassemia patients, especially in those who are splenectomized and usually age more than 30. Why thrombosis is a risk factor in thalassemia? Because there are actually many reasons. It's a multifactorial morbidity. First of all, is due to the circulating erythroblast, so the progenitor of red cells, which are present in the blood of thalassemia patients, especially in those splenectomized, because these cells have a procoagulant activity due to the membrane alteration. I don't want to go into details, but this is one of the points. Second point are the platelets. Platelets in a splenectomized patient may be very high, and they have an increased risk of creating a thrombus in a small vessel. But that's not enough. There are other factors, such as the endothelial alteration. There are increased number of endothelial cells who adhere to the membrane, and also an increase of protein which are supporting this adhesion. And then there is another point which we are start to realize that important, and this is the heart.
Sí.
Why the heart may be involved in thrombosis. We found, and we are going to present a paper in the coming weeks, we found that adult thalassemia patients have an increased prevalence of atrial fibrillation.
Ok.
So it's not due to iron overload, but this is due to the function of the heart. And the atrial fibrillation in a general population is per se a risk of thrombosis. So we found out that in thalassemia patients, we have quite a high prevalence of atrial fibrillation, and we need to identify that and to prevent that, because it can be responsible of stroke or other thrombosis, and particularly, for example, in pregnant women.
Sí.
Thalassemia pregnant women may be more at risk for thrombosis. So all these things together require a special monitoring and attention in order to implement the proper treatment of this problem.
Yes. A senhora disse que a probabilidade de o paciente que fez esplenectomia ter um risco maior. Então, no meu caso, eu sou uma pessoa que fiz esplenectomia. O que a senhora aconselharia as pessoas como eu já fez esplenectomia a ter cuidado para não ter uma futura trombose?
Okay. You have the age to be splenectomized, because back to 30 years ago, how old are you? Quanti anni tieni?
4.
40. Okay, going back to 40 years ago, we used to do splenectomy because we didn't know how to treat it. So most of the patients of your age are splenectomized. And the message I want to leave is, not to create a problem, but for all the splenectomized patients, I suggest to be more careful and to monitor some coagulation parameters. And whenever you have, let's say, pain on your leg, which is maybe due to superficial vein thrombosis, that imply to have a Doppler, to check it, and immediately to start a proper treatment, which can be anticoagulation and anti-aggregation. So, for example, in pregnant women, we always suggest to be strictly monitored and to start anticoagulation during pregnancy.
Ok. Doutora Cappellini, thank you very much. Gracias
Thank you,
por ser essa
Eduardo.
pessoa maravilhosa.
Thank you very much,
Thank you.
Eduardo. It was a pleasure for me. Good.
Thank you.